Namaste and welcome to all our participants of Easy Ayurveda Gurukula. So today is episode 26 of our Gurukula. Cordial welcome to all of you. We also have Dr. Gururaja sir with us. Cordial welcome to Gururaja sir as well to Gurukula session. So today we have Dr. Rajnikant Patel with us. Very familiar face for our Guru Bodha and Gurukula sessions. Not only to that, but also to Easy Ayurveda family. So being a panel member of our consultation team. So on behalf of all the participants and Easy Ayurveda family and Easy Ayurveda, I extend a cordial welcome to Dr. Rajnikant Patel. Dr. Rajnikant Patel, welcome to Gurukula.
Namaste.
Namaste. Friends, I would like to give a brief introduction of Dr. Rajnikant to all of us. So he is the chief Ayurveda consultant at Agnivesh Ayurveda Hospital, Surat, Gujarat. So having more than 7 years of very good clinical experience, known to handle the most difficult and complicated and critical cases, and also some cases which are in ICU. So he successfully handles very complicated cases. That is his territory of Dr. Rajnikant Patel. So he's known to analyze and decode complicated cases and also draw some successful protocols to treat those conditions, and also has treated many cases of mucormycosis and complicated COVID-19 conditions. So handling critical patients is his territory, as I already said. So his favorite areas are dealing complicated cases of neurodegenerative diseases, cardiac diseases, cancer patients, and some other clinical emergencies. So apart from being a very good clinician, Dr. Rajnikant Patel is also a very good speaker and writer, as known to our Easy Ayurveda family. He has been invited as a guest speaker and also an expert speaker on various platforms and institutions. Today he is with us to present a very interesting topic, milk of different animals and its clinical utilities and Ayurveda perspective. Without wasting any time, I would like to hand it over to Dr. Rajnikant. Rajnikant sir, all over to you.
So today's topic is very much interesting, and that is a milk of different animals and its clinical utilities and Ayurvedic perspective. It is perfect suitable for present time to discuss on the various different animals' milks and their clinical utility, because this is the time when majority of the doctors in the Western country, they straight away say no to the milk for the newborn baby. They even say no, breast milk also can be given to the children if there are some little bit minor issue also to the children. So it is a very sad to hear that in present time most of the doctor says no to the milk, even for small children also and even for adult. There are some condition where milk is contraindicated, that we will see. But in very few conditions it is contraindicated. Majority of the disease we can give milk, or we can give different animals milk. So all these aspects we will see in the coming slides. So thousands of years of human observation and trial and error are far more greater than the 6 months of rat experiments in the lab. And because of this, we must respect our Samhita and Shastra. So when we see modern science or modern people are doing research in the laboratory for 3 or 4 months or 6 months in the laboratory animals or on the human beings, they do research for 3-4 months, and maybe 1,000 human or 10,000 human beings, they will do a research and they will apply the conclusion of that research to the pan public. For example, India is a country of 140 crores of people. Government or company will do a research on 10,000 people or 1,000 people, and they will come with a conclusion that this medicine has helped in this 1,000 of patient. Then they will apply to whole country. So they cannot work in this time. Now compare these things to our Shastra. They have seen thousands of patients. They have done trial and error, and the fruit or the malai or the conclusion of this, they have written in the form of sloka in the Samhita. That is our Laghutrayi, Bruhatrayi and all other subsequent Samhita. So we must respect our Samhita and Shastra. When we see modern science, they have many hypotheses or many research people available there. They will say that milk is not allowed in this time, this kind of patient milk they should not take. But our Samhita says milk can be taken daily. It is suitable for everyone from newborn child to the old age people. So that's what we must respect our Samhita and Shastra. So before going deep into the specific subject about milk, I would like to highlight one slok from the Charak Samhita Sutra Sthana, I think second or third chapter, where Acharya Charaka has given a list of the food items that can be consumed daily. So these are the set of food items. If anybody is consuming from early childhood till he dies, there cannot be a problem. If he consumes Sachtika rice, that is the rice that prepares in 60 days, there is a Shali rice, then green gram, then a rock salt we have, then amlaki we have, then yava we have, rainwater we have, milk we have, ghee we have, and fresh, mamsa of a jungle animal and honey. So Sachtika, Thali, Mudga, मुद्गस्य सैंधव अम्ल के यवान अंतरिक्ष पयम सर्पी जांगलम मधु च अभ्यासे. So these things cannot cause any damage, or these things cannot do or cannot give any trouble to our body if we consume these things daily also. That is what we have a reference in our Charak Samhita. That Sashtikashali rice, we have green gram, rock salt, amlaki, yava, rainwater, milk, ghee, fleces of jungle animal and honey. So our Acharya has permitted to use these things daily without any trouble. So these things without any confusion or without any doubt, we should consume it daily. So this is the Shastra reference. If we compare these things to the modern science, you can see this is the complete diet. It has protein in this, we have carbohydrate in this, we have fat in it, we have all the macro and micronutrient available in this. So this is the perfect dish that our Acharya has explained. Or this is the complete diet. If we consume these all things, we cannot have a problem of vitamin or nutrition deficiency because it is a perfect diet. We can see it has the protein content, it has the carbohydrate content, it has the fat content, it has the all the content which is required for human body. So this slok I would like to highlight, and we must understand that this thing cannot give any kind of trouble to our body if we consume it daily. And so on, it applies to the milk. So I have highlighted the word milk in the red font with underlines because we are discussing on milk, and we have a reference that milk can be consumed on the daily basis. So general quality of the milk. Acharya Charaka in his Charak Samhita writes that Dugdam Chiram Payah Stanyam Bal Jivanam Iti Api दुग्धम समधुरम स्निग्धम वात्पित्तहरम सरम सद्य शुक्रकरम शीतम सात्म्यम सर्व शरीरिणाम जीवनम ब्रह्मणम बलियम मेद्यम वाजिकरम परम वय स्थापनम आयुष्यम संधिकारी रसायन. So it has got a very beautiful quality, and people nowadays going far from the use of milk. The milk is Sadhya Shukrakaram. Sadhya Shukrakaram here means it increases the Shukra Dhatu instantly. We all know there is a 7 Dhatu, Rasarakta Mas, Medasti, Madhya Shukra. When we take a food, the food after getting being digested with the Dhatu Agni, the Ahar Rasa is getting formed. From that Ahar Rasa, Ras Dhatu is getting from Ras to Rakta, Rakta to Mas to Med, Med to Asti, Asti to Madhya, and Madhya to Shukra. So these are the Dhatu formation cycle, and we have different Naya also, Kalekapota Naya, Kedari Kulya Naya, so which Dhatu gets formed in our body. But it is the Prabhav, it is the super special quality of milk that immediately after drinking the milk, we get the Shukra Dhatu formation. So this is the very important and beautiful things which our Acharya talks, that it is the Sadhya Shukrakaram. Suvarna is Sadhya Shukrakaram, Ghuta is Sadhya Shukrakaram, and cow milk is Sadhya Shukrakaram. According to me, I think there is only 3 things which is mentioned in our Ayurveda that form the Shukra Dhatu instantly. So that is a cow milk, cow ghee, and third one is Suvarna. And we have reference for all these 3 things that it is this Sadhya Shukrakaram. So use of cow milk daily increases the Shukra Dhatu or forms the Shukra Dhatu on daily basis. So this is the main importance. And Shukra Dhatu is responsible to maintain our immunity and to maintain our health. Because from Shukra we have next Ojas, and Ojas is what we can compare with immunity. And another important quality of milk, Acharya talks, is Sandhi Kari. It unites the things together. When we see the health according to Ayurveda, that is the dosh dhatu mala mulam sharira. So perfect equilibrium, I repeat, perfect equilibrium in between three dosh, 7 dhatu and 3 mala. If these 3 things together three dos, seven dhatu, and three mala. These three things together are working normally on proper day. Then only we can have a good health. So what cow milk does here is we can use our yukti and we can say that it does the sandhan karma of those dhatu and mal. Drinking of cow milk on daily basis keeps those dhatu mal very sandhan, means very, it unites all the three dosha, all the seven dhatus and all the three mala. But remember here is we are talking about normal functioning of those. We are not talking about vitiated dosha, we are not talking about vitiated dhatu, or we are not talking about vitiated mala. Dosh is dhatu if it is not vitiated, because dosh has prakrut karma. Dhatu also has prakrut karma, mal also has prakrut karma. But once it is getting buddhi or chaya, once it is getting increased or decreased or imbalanced, then only it will cause a disease. So when we consume milk on daily basis, it will do the sandhana, or it will make a stronger connection between the healthy dose, healthy dhatu and healthy mala. So that is dose dhatu mala mulam hi shariram. So daily use of milk, we can get dose dhatu mala mulam hi shariram. That we get the best quality of health, healthy life and long life. And we also have vayasthapanam. So it increases the age, or it stabilizes the age. Okay, so we have discussed the general quality of milk. This is not pertaining to the different any specific animal's milk, but it is the general quality of milk which Acharya Charaka has described. And we must focus on two things here: Sadhya Shukrakaram and Sandhikari. Sandhikari means anything which unites together. Sandhikari means we should not just take a bone fracture and sandhan of bone or sandhan of asti. Anything we needs to unite together, there the milk has a great role. For example, infertility is there. Male and female partner both has all the normal report. They don't have anything abnormality in the reports. Where we can do sandhan karma of Shukra and Sonit. Shukra Sonit, if getting proper sandhana, then only Garbha Utpatti will be there. So in that way also we can take based on our Acharya Bhavaprakasha has given 5 paryaya shabda or synonyms for the milk in the Ayurveda. The first one is Dugdha, that we all are familiar with. Cheer, that also we are familiar with. Payaha, that also we are familiar with. Then Stanya is also synonyms. And interesting to know that Bal Jivan is the synonyms for milk. That is explained in the Bhavaprakasha Samhita. So they have given a special word that denotes to the children that milk is the life of the children. You see, Bal Jivana. What is Bal Jivana? Life of children is nothing but a cow milk or the mother's milk, which now modern people say that milk cannot be given to the children due to the allergy and whatever. So in those cases, we must treat the allergy. Then we start this cow milk. It is not that they have allergy, so we don't give milk. If you are not giving milk to the children, then Bal Jivana purpose is not served in that case. Then these children once grow up, he have weak immunity, he will become ill again and again. So these are the 5 synonyms given in Bhavaprakasha Samhita: Dugdha, Chira, Payara, Stanya and Bal Jivana. So now next we will see the different animal wise quality of the milk. First one and superior in all the milk, that is the cow milk. Swadu Shitam Mrudu Snigdam Bahalam Slakshanam Pichilam Guru Manda Prasannam So Gavyam Dam So Gavya Dasagunam Paya. So it is a swadu, that is a sweet in the taste. It is a sheet, cold in the potency. It is a mrudu, it has the soft quality, or it works on this. This is guna, softness where we require. We can give cow milk. Then it is a bahala, that is umpierce. It is a slakshana, it is a dense. Pichila, that is a glossy. Guru means heavy to digest. Sorry, pichila is glossy, viscid. Then Guru to digest, heavy to digest. It is a Mandaguni Yukta, that is the slow, and it is a clear in the consistency. So these 10 gunas are explained in Charak Samhita for cow milk, and similar guna we have for ojas. So what we said in previous slide here, that those dhatu mala mulam hi shariram. So proper equilibrium, or the proper equilibrium in the terms of proper uniteness, or together uniting the those dhatu and mal gives the best health. And when we can achieve best quality of health and long life, only when we have a proper or best functioning dhatu in our body. So is the cow milk has the all the 10 quality which we require for formation of the process. So it is now clear that to maintain a healthy and long life, we must use the cow milk on daily basis. So these are the quality of cow milk, and it is a superior among the whole types of milk. Interesting to note that Acharya Sushruta has said that the cow milk is a alpha abhishandi. It's not that much abhishandi in the terms of or in the comparison of if we compare the dahi or curd. Curd is a highly abhishandi and cow milk is a alpha abhishandi. Means we must boil it before using. So raw milk, if we are taking, it has the alpha abhishandi guna. Once we boil the same milk of cow, then it becomes normal. It won't cause that much abhishandi guna in it. So this is the extra reference for cow milk that Acharya Sushruta has said it is the alpha abhishandi, but not Acharya. We saw the general quality of cow milk. And when we study, when we refer the another other Samhita apart from Bruhatri, then we have a Bhavaprakash Samhita and Harita Samhita. In those Shastra, it is written on the based on the color of cow. So we have a red and black cow. The milk of red and black cow will be Vatnashak, and it has the more good quality. The cow which is yellow in color, the milk of that cow will be Vat and Pitta Shama. And the least one and the inferior one is white color cow. That is the cow of karak. So the cow which is white in color, we may take as a Jersey breed that we have in India nowadays. Many villages or many farmers have Jersey breed, and Western country also we see Jersey breed in majority of the area. So that white cow's milk, it actually increase the cough of those. So it is then might be the reason of Santarpajanya Vyadhi is more in the Western country. Disease, non-communicable disease are more in the Western country. That might be the reason due to they use the milk product of white cow. So this increases the cough dose in the body. Now vice versa, we see the red and black cow. That is the Indian breed. That is the desi cow, desi Indian cow or a ghee cow. Ghee cow is again a superior types of breed. And ghee cow is a basically natural habitat in Gujarat, in the ghee area, ghee forest area, Junagadh district and all. But now it is spread to all over the world. You may search the story of which country I forget. Their whole economy are, I think, Brazil or I don't know which country. Their whole economy are based on the ghee cow, and they have imported ghee cow from Gujarat, India, and they have started their like this, and they have doing good business. Okay, so red and black cow milk is very good in the quality. Yellow, it will what with chamak. White is we should not use white cow's milk because it is top para. So that is Jersey breed. Red and black is the desi ghee guy, that Indian breed. The milk of cow which don't have a living calf is a tridosha karak. That is what written in the Harita Samhita. And now one must have a question that how can a cow give a milk if she doesn't have a calf? So here what Harita Samhita means to say when he says about milk of cow which doesn't have a calf is tridosha karaka. So after the normal birth, the calf has died for any reason, whether it is natural death or due to some disease. So the mother will have a sorrow or the pain in their heart or in mind that she has lost her children. So the thought of the cow, it affects the quality of the milk, and thus those kind of cow, their calf is died. So we should not use the milk for our human consumption. It will increase the tridosha because the mother is suffering from the sorrow or sadness because of losing her children, like cow. Okay. So milk of cow which we should not take, and if we take, it will increase the tridosha. That is reference from the Harita Samhita. So the cow milk is the best in the category of Jivani Dravya, so it is called a Rasayana. Rasayana, we call the Rasayana to the cow milk because it is the best in the category of Jivani Dravya. We know there are a list of Jivani Dravya, but cow milk is the best among the Jivani Dravya. So we have, which the Acharya has said it is a Rasayana. Okay, we have now another reference that why cow milk is the best among the all. So this is from Kashyap Samhita and Harita Samhita that cow eats only nutritious parts of the grass like grass blades. That is the top portion of the grass, which is the sarabag of all the leaves and flower, etc. And these parts are the mostly Madhurasa dominant and highly nutritious parts. So that our Acharya has written that why cow milk is best among the all animals, because cow is the only animal when when she or he eats the grass, it won't eat away the whole grass, including the roots. But buffalo animal will take away the grass and it will eat everything. But in the case of a cow, it will he cow will only eat the only superior part or the upper portion of the grass, the grass blades or the flowers, and these parts are mostly a Madhurasa dominant, and so on we get the ojas grown in the cow milk. So this also we have a good reference in Aditya Samhita. We see the buffalo milk. Mahisa Mahishinam Guru Gavya Achi Tarapaya Sneha Nanyama Anidra Ahityam Karinetsa. So buffalo milk is heavier and the colder in the potency compared to the cow milk. So the cow milk is it is also guru, but it is more guru than the cow milk. So buffalo milk is more guru. So by default it will increase the cough dose and it is cold, more shitata it has. So again it will increase the cough dose and it is a more unctuous, it is a more clay yukt. So again it will increase the cough dose. So it is heavier than the cow milk, it is colder than the cow milk, it is more clay yukt than the cow milk. So thus it increase the clay or it increase the cough dose in the body. So due to this specific quality, the buffalo milk is very much beneficial in the treatment of anidra and in case of tiksha agni. Or when we say beneficial in the insomnia where or loss of sleep is there, then we can advise buffalo milk. Just use of buffalo milk can give a good and sound sleep to the patient. We must try all once. And to reduce the excess agni, excess digestion and metabolism, where the metabolism is hypermetabolism is there in whichever disease, then we must use the buffalo milk as the daily milk supply. So buffalo milk, as said in previous slide, it can be used in anidra and the tiksha agni cases. Now we have camel milk. Ruksha, Usna, Kshiram, Ustri, Misham, Tatsa, Lavanam Ladhu, Sam Sattva, Vata Kapha, Ana, Umi Shofa, Udar, Arshasa. So it is a roots, it is a dry in the nature, it is a hot in the potency, it has the salty taste, Lavan Yukta Ras, it is lagu to digest. Now it is indicated in Vata and Kapha disorder, Malabandhata, that is constipation, Krumi Rog, that is parasite infection, including bacteria, virus, and fungus. Also helpful in edema, Udar Rog, and piles. So in the treatment of mucormycosis, camel milk is compulsory. So what we have observed in the treatment of mucormycosis, more than 1,400 or now I think 500 case, 1,500 case. Those patients who are taking camel milk are showing significant improvement. In those also, the patient of mucormycosis who are taking fresh camel milk, those patients saw significant improvement in just few days. Without use of any medicine, we have just advised them to use the fresh camel milk. No other medicine and no water and no other diet also. Like how Udar Roga we follow the protocol, milk only in the diet. In Krumi Rog, we advise if critical case are there, we stop all the food and the water, everything. We just give fresh camel milk and we see significant improvement in just 4 to 5 days. So that is what it is mentioned that Krumi Rog. And if we read Sushrut Samhita, I think Sushrut of Desajitnavali, there it is mentioned that in the Krumi Roga, all the milk are prohibited. Okay, in spite of cow milk having good quality, it is still prohibited in Krumi Roga. Only camel milk is allowed in the treatment of Krumi Roga. All other milk are strictly contraindicated in the Krumi Roga. And mucormycosis being one among the Krumi Roga, we don't advise any milk except camel milk. Where exactly to be used camel milk? So we get 3 or 4 generally in the market. Cow milk we get plenty in number, buffalo milk we get, goat milk we get, and camel milk also we get. At least powder form, but we are getting. So where there is a too much clay in the body. So for example, I have written here Vidradi. Vidradi like Vyadhi, where there are too much clay accumulated in the body. So what type of internal abscess can be compared with Ati clay in the body? To reduce that clay, we must use camel milk in all the patients where Vidradi like Vyadhi, which includes all types of internal abscess. And all the disease where there is a fluid accumulation will be there. There the use of camel milk will be the best to be used. For example, pleural effusion, we can use cardiac effusion we can use, ascites also we can use camel milk, and we have reference also in the Tarak Samhita Udar Rog Chikitsa. So camel milk is to be best when we use in the there is a too much fluid inside the body and there is a fluid accumulation in the body. And we have the reference soft, udar and krumi. So krumi here we can compare as a broad spectrum. We can take parasite and also we can take bacterial infection, viral infection, fungal infection. In all these infection, camel milk must be given rather than the cow or buffalo milk. I'm talking about the diseased condition, not the healthy condition. So this kind of disease, camel milk is best, and we practically felt that Kumiro and fluid accumulation patient and clearly Yukta patient, it is the best giving camel milk give the significant improvement. So we must use camel milk in this type of condition. Now, interesting to note that Susuta has told that this camel milk is Vishnashak. So only few things in Ayurveda has been told is it has the special quality of Vishnashak. We have gold, it is the best for Vishnashak, Suvarna Basma. Then we have cow ghee, that is also Vishnashak. Then we have few herbs like Bilwa we have, Shirisha we have. Then in the class of milk, in the Dutta Varga, Chira Varga, only Ustra Dud or the camel milk has the quality to pacify or to nullify the effect of poison or to nullify the effect of toxin in our body. That is the reference from the Susun Samhita. So in any condition, septicemia, for example, we have patient has the septicemia, all the antibiotics are showing resistance, there is no improvement. Then we must start camel milk daily 2 to 3 liter to tackle down the septicemia or to reduce the bacterial, viral or fungal infection and to prevent the major organ damage. So that is the Vishnashak gun of camel milk that is being explained by the Susu. Now we have a goat milk. Sadam Kashayam Madhura Shikam Grahi Payo Rakta Pitta Ati Sarakam Shayak Vasit Dharapa. So it is a Kashaya, that is the astringent, and it is a sweet in the taste, it is a cold in the potency, that is the sheath liquor. It is light, it is very easy to digest, specifically indicated in the disease of Rakta Dhatu or Ati Pravruti of Rakta Dhatu is there, Rakta Pitta is there, Atisara, diarrhea is there, Roga we can give, and cough and fever. So, Rakta Pitta, Atisara, Gnam, Shaya, Kaso, Dhurapaha. So, these are the set of disorders where our Acharya has permitted to use the goat milk. That is the Rakta Pitta, Atisar, Shay, Kas, Jwar. So, in all the diseases, we get a best result. So, in Jwar, we cannot give cow milk in the Purana Jwar. Now, Jwar, it is totally contraindicated. But it is Guru. In Jwara, Agni is Manda, so is the Jwara is there. So we must use the Lagu quality of milk. And in any other disease where Agni is low and we want to use the milk, then we must use goat's milk only. Other one milk are heavy to digest. But goat milk is Lagu to digest. We have a sheep's milk that is not at all. It can be taken because it doesn't have any good quality that is suitable for human being. That is the Hikka Swas Karam Usnam Pittam Sleshma Havikam. So it causes hiccup, it causes dyspnea, and it is hot and it increases the pitta and kapha. So sheep milk, our Acharya has not advised to take a sheep milk because it will cause the hiccup, that is hiccup, it can cause dyspnea. Dyspnea is if it is consumed, it is hot or in the potency, and it also it aggravates the pitta and cough dose in the body. So sheep's milk is not allowed for at any condition. Then we have elephant's milk. Astini, Payam, Payo, Balyam, Uru, Sthaiya Karam Karam. So interesting to highlight the last word of the sloka, Sthaiya Karam Karam. So that we will discuss in next slide. So elephant milk is a guru, it is heavy to digest. Balyam, it gives the strength, and Uru Sthaiya Karam Karam. That is excellent stabilizer of the body. Now we will see with the word Sthaiya Karam Karam what we should apply clinically. That we will see. We know Sthaiya Karam Karam means it is an excellent stabilizer. Now we will see clinically how to apply these terms. Sthaiya Karam Karam, that literally in English if we translate, it is the excellent stabilizer. Now stabilizer in terms of disease condition where we can exactly correlate this or how we can decode this word. So there is a condition in which person or patient has the uncontrolled movement. movement which is not there in the control of patient. For example, all the kind of dystonia, the initial stage or the initial symptoms of the Parkinson disease, where there are uncontrolled movement. So in these kind of cases, we must use elephant's milk because it is the best to give the stability, or it is the best to give the stereokaram. It is stereokaram. So any condition, for if any patient come to our OPD and we see that there is an uncontrolled movement, that is to stabilize the uncontrolled movement, we must use the elephant's milk. Now, uncontrolled movement at a full swarupa, we can observe the patient's uncontrolled movement. Like patient is doing like this, that we can observe. But uncontrolled movement at cellular level can be taken as a cancer. It is also uncontrolled movement, but of cell that we cannot see, but we feel based on the history patient give or the complaint patient say. So, full rupa uncontrolled movement that we can see with our naked eye that patient is having the neck dystonia, neck is like this, tremors in the Parkinson. That is uncontrolled movement. That is a full root that we can see with our naked eye. There we have to use elephant's milk. Full at Sukshma root, when we see the excellent stabilizer or uncontrolled movement, that is the uncontrolled movement of the cellular level. That is the uncontrolled division of the cell. Cell division at uncontrolled rate. And also metastasis of the cancer. So this we haven't used elephant's milk, but I'm sure I will use elephant milk soon. In the cases of metastasis of cancer, distal metastasis, and the people who are in research field or who are in academic field, they must do a study and they must find out the effect of elephant milk in the cancer metastasis because it has the best quality among the all types of milk. That is the Stevia karam. Even cow milk doesn't has this quality. So these are the important and beautiful things about elephant milk. It is the Stevia karam. Now another importance in the class, that is the human milk. Jivanam, Brahmanam, Satyam, Snehanam, Manusyam, Payah, Navanam, Rakta, Pittam, Tarpadam, Oxyfulic. Now, so the human breast milk, it has the Jivaniya quality. It gives the good life to the all the system and good cellular level into the Jivani effect. It is nourishing. It increases the all the dhatu. It is a wholesome. It is satmya. Nobody can say that children should not have a mother's milk. It is the satmya. The person who are saying that children should not take mother's milk due to this or this reason, it is very wrong. Newborn children must receive the mother's milk at any cost because it is the satmya and it is made for the children only. So it is useful as a nasal medication in Rakta Pitta. In Rakta Pitta, we may give a Naval Nasya. Rakta Pitta, we can give Nasya. Also for oral also we can give. And it is best to be used in the all kind of eye disorder. It is written Akshi Shuro and like this only. That is also soothing to person having the pain in the eyes. So these are the about human milk. That is the satmya. It is habitual to all the person, wholesome. It cannot cause a trouble. It cannot give a bad effect to any person. Now I will show you one or two cases where we have used breast milk overly or too overly in the. So this is the one case. You can see the before photo. Too much clay is there. Too much. It is a pitta and cough dose. Too much pitta and cough dose prokop is there in the eyes. You can see. In this patient, along with oral medicine, we have advised two drops of fresh breast milk of a human to be instilled in the eyes, and we can see the results. This patient was advised to remove the eyes because they have tried all the antibiotic orally as well as IV antibiotic, but the infection was not coming under the control. So they have advised to remove the whole socket of eyeball, including all the muscles around. Then patient came to us and we have started medicine, oral medicine for pitta and cough dose or samana, and for eye drop, we have given the breast milk every hourly 2 or 3 drops every hourly from morning to evening, and you can see the results. Patient didn't improve the eyesight, but we have saved him from removing of the eyes. Patient has eye normally, but it's not seeing. It's okay, but we saved his eyes. So this is the one case. This is the another case. You can see the before condition. Redness is there, pain is there, pitta segregation is there in the netra. puff is also there. You can see the whole Shvetvarna layer in the eyeball, in the retina especially. And after 15 days of oral treatment plus human breast milk, you can see the result. So all the critical condition, I'm not talking about normal condition also, we can use the human breast milk. But when the modern science has advised that in this case, we must remove the eyes. In this case, we must all should try the human breast milk, and I'm sure I assure you that you get the best results in this type of cases. Not out conjunctivitis, normal case also we get, but these kind of cases we must use the human breast milk. You can see this case result where we use breast milk along with the oral medicine. Going further deeper, okay. So the milk of the animal of uncloven hoof, the hoof or the it's English, I don't know exactly, but uncloven hoof means the lower part of the animal leg, uncloven hoof. There will not be a cloven hoof. It is a single hoof. So the milk of animal of uncloven hoof, that is equines, including the horse and mares, etc., is strengthening. It is a stabilizing. It is a hot. It is slightly sour and saltish. It is dry and effective in treatment of vata of the when the vata is getting lodged in the shakha. So this is very important. Very few medicine in the Ayurveda is specifically indicated in the shakhagat rog or posthagat rog or marmasti sandhigat rog. When we see shakhagat vayu is there, shakhagat vayu is there means the vayu is there in shakhagat rog marga. In those cases, we must use the milk of animal of uncloven hoof, like a horse and the breed of donkey, bears. All this milk can be used in the Shakhagat Vayu. Means the Vayu Prakop is there in Shakhagat Rog Mark. Also, it is the strengthening, that is the Balium, Stherium. It is also Stheriakaram, Uchnam. So, Ekashafapaya. Ekashafa means unclove hoof. The animals in the leg, below the leg, they have this nail type. So uncloven hoof. Search in the Google, I am not able to explain in the English what exactly uncloven hoof. But you check on the internet uncloven hoof. Below it is based on their dividation of their legs lower part. Okay, so now we will go further deep in the Shakhagat hoof because the uncloven hoof animal is best to be used where the Shakhagat Vayu is lodged in the Shakha. So what Shakha we can take? Shakha is Rakta Adi Dhatu and Tva. There are seven dhatu. You leave the Ras dhatu. Rakta to Shukra comes under the Shakhagat hoof mark and also skin. Also, Charakacharya has given the Shakhagat rog, that is the Ganda. We will go to translation only. This is like Ganda that can be compared with goiter. Pidaka is the pustule anywhere in the body. Allergy is the boil. Apathy is apathy. Apathy can be taken as metastasis of cancer. Lymphadenopathy also it can be taken as apathy. Sarmakila, that is the viral warts. Adhimamsa, that is the muscular new growth. Adhimamsa can be a external growth that we can see on the skin, or it may be benign growth or a non-cancerous tumor. Mashaka is the moles, Kushta is the skin disorder, Vyanga, that is the discoloration of the skin, moles, like we can say, also the external variety of Visarpa, that is the skin disease, or the metastasis of cancer can be taken as Visarpa at some stage. Soyatu, that is the edema, Ulma, Arsha, and Vidradi, all kind of abscess comes under the Vidradi. And disease of Shakha, all these diseases are the Shakha Gata Rog. And in these, if we observe Vayu is getting Prakop, or all the three dosha, Vayu is more in the Shakha or in this disorder, we must use the milk of horse, mares, or donkey, or any other animal which has uncloven hoof. So these are about that uncloven hoof animal's milk. So we can see how beautifully our Acharya has explained the different qualities of milk of different animals. It is not a very vast subject, and there must be more and more study on this. And doctor practicing must use different quality of milk. They should get practical experience, and they must share with all the Vedya that this kind of animal's milk is based in this disease. For example, in mucormycosis, we have used plenty too much this camel milk, and we got best result. So it is as proof that whatever written in our Samhita, it is 100% right. There must not be any doubt or any question or confusion in it. But we must use and fill. Now, going further deeper, then the quality of milk when it is taken in the morning or evening. Taken means when we remove the milk from the animal. If we remove milk in the morning, it has the different quality. Same animal, if we remove the milk in the evening at the sunset time, it has the different this quality. The milk which is taken out from animal in the morning, it is guru to digest. It is that is heavy to digest. It is the wisdom the karaka. That is the it causes the chronic constipation. It is a sheath in the womb. It is the cold in the potency. It is the because now why this quality? Because the night is the dominant of moon or the chandra. That is the kapha prakopa is there. So and the animal will be inactive in the night. So there is a kapha prakopa by default. So in the night, animal will be sleeping. You are not sleeping. It will be standing, but not active. And night is the moon pradhanyata, Chandra pradhanyata, that is the moon dominant. So Shita moon and kapha will be more in the night. So that passes in the milk, that moon. So the milk, the person who is consuming milk in the morning time, which is taken out from animal in the morning, it will cause constipation. It has it will be heavy in the digestion and it will be cause sheath in the nature. So, for just to give example, for example, we all the doctor has the constipation patient in our OPD. So we must ask the patient you whether you are drinking fresh milk or dairy ready-made packaged milk. Patient say no sir, we are drinking fresh milk. Then we must ask them you order milk in morning or evening. If evening they are ordering, it's okay. But if they say we are getting fresh milk in the morning and we drink a morning only, so chances are there that this might be the nidana in those constipation case. So just avoiding morning milk, it may cure their constipation. So these are the basic we must ask in the patient history. Same when the milk is taken in the evening from the animal, it will be vayu nashaka because of anulam gun. It will be good for the eyes. It removes the tiredness, and this is due to the animals will be active in the daytime. Okay, so it has the anulomana gun indeed. So it is good for eye. It removes the tiredness. But same animal, same cow's milk, if taken in the morning, removed in the morning, it will increase the soft dose. So this must be clear, and we must advise the patient to drink milk of evening taken milk from the cow. So this is the important thing. Now again we have raw milk have another quality and boiled milk have another quality. So the raw milk it is the clay the karak and guru. It will increase the clay, it will increase the cough aggravation and it is guru or it is heavy to digest. Then we have boiled milk. It won't cause that much clay and it is low because we boiled it. So except human milk, all other milk should be boiled before consumption. This is the reference from Sushruta. All the animal milk must be boiled before consumption, but human milk cannot be boiled. It has to be used as it is. So we have some. I have selected few reference here that milk is highlighted in the treatment of any vyadhi. So one among the diseases is the rope and milk, and this reference has been taken from Acharya Charak Samhita. So he has advised that Udara Rogi or the patient of Udara Roga should consume only camel milk with trikatu. Of it is not available, then he may consume goat milk with trikatu, or it is not available, then cow milk with Shilajatu. He can take. He has given option camel milk, goat milk, cow milk. But what I personally think, or my personal opinion on this Udara Roga is, we must use camel milk more and more. It's okay. Camel milk is not there means we have to use goat or cow milk. But camel milk, it has the show of udar, ulcers, vishnasha bone in the camel. So it will be, we may get good results compared to with the gold and cow milk in the use udar row. And all the chronic disorder of liver and spleen, that is the yakut and pliha, can be well managed by just a milk diet. No other things in the diet. And we all know, respected Guru Raja sir, he is a very much expert and has a great practical experience in the treatment of liver disorder. And he always states that diet should be milk only in the liver and spleen disorder. And we all see the sir's good work. And recently, sir has said 2 days back a very good case where liver cirrhosis was there in USG before Ayurvedic treatment. And after taking treatment from Guru Raja sir, again USG has been done, and it showed no sign of liver cirrhosis. That is a commendable work, and Guru Raja sir has said all the treatment. So this is the main thing. We must read our Shastra deep and thoroughly, so we may get this small point. Actually, it is small, but very much helpful in the practice. So all the disorder which involves liver and spleen health is disturbed, but the patient can be very well managed if we put patient on just milk diet, camel milk, goat milk, or cow milk. But in ascites or liver failure, I highly advise use of camel milk. There is a contraindication also. Text that Shothrob, Susuta has said Shothrob cannot be given. Navadvara, it cannot be given from Basic Jaratnavali, Agnimandia, we cannot give seed. Ustra also we cannot give. Ustra we can give only Ustra milk, Ustra seed, that is the camel milk. Then Vruddhi Rog we cannot give in oral disorder. Mukha also we should not give the milk. So these are the contraindications. So again, thousands of years of human observation and trial and error are far more greater than the 6 months of great experiments needed. So we must respect our Samhita and Shastra. So very deep things about milk and milk's quality has been mentioned in Ayurveda. I have selected few points in this slide, but you may refer all the Samhita. You may get more and more interesting things about milk. Thank you for listening me, and I finished here, sir. Raghunath, sir. Thank you.
Thank you so much, Rajnikant sir, for your not only a vast and good presentation on different types of milk used in different disorders, but also your clinical experience with using many types of milk. As you rightly pointed out, you too has been emphasizing since a long time the camel milk that you used during the COVID time, and also in mucormycosis cases that you have been advocating time and again, how that became popular and how you used camel milk in so many different conditions. When we go through our Easy Ayurveda discussions, which we have in the group, as you rightly said, Honorable Guru Raja sir also has been advocating strict use of milk and milk patya, milk as patya in different abdominal disorders or udara rogas, jalodara, and even different cases that you have mentioned rightly. So this, I feel, a physician should have a comprehensive knowledge, a total thorough knowledge of the dietetic protocol, which almost is equivalent to the medications, or it comes handy as a companion in the prescription of many medicines. The dietetic prescriptions and also the advices, which type of milk we select in which conditions, and where do we advise, where not we. So those things are also very important. You also emphasized on the external use of milk, like breast milk being used as the drops in the eyes in some complicated conditions. Needs a lot of knowledge of milk. Right now, Dr. Rajnikant will take some questions. So first of all, coming to Kalaji's question, in Western countries, cows are getting hormonal medicines and antibiotics. This has influence on the milk quality. And Kalaji asks your opinion of such milks, which have been treated hormonally and with antibiotics.
We should not use those milk. We must find a cow farm, or you must find a cow farm in your country where they use the least amount of this thing, modern chemical, or they don't use. Or make a group and make a cow farm. You may start with 1 or 2 cows, then people will join. That can be done. We cannot fight with those large scale or large industries. We must have our own cow at our home. That's what Indian rural area has.
Absolutely, sir. And I think that answers the question. Vikramji, in his elaboration, has mentioned why Indians, or in Bharat, he has mentioned like the cow has been treated as Gau Mata, and also it is worshipped, its divinity we know already, and how different countries, maybe be it in Bharat or outside Bharat, how the cow is looked from non-commercial and commercial perspectives. So Vikramji has posted his opinion there, so you can read it in box. Thanks for that opinion, sir. What is the difference between gheer cow and desi cow, and difference between gheer cow ghee and Bilona ghee and design ghee? So that's what Kalaji asks.
Bilona is like this. That is Bilona ghee. I think it is the preparation of method. That's it. Nothing. Gheer cow. It is the Gheer is the area in the Gujarat. The breed of that specific area is called the gheer breed. Desi guy is looks similar to the gheer, but gheer guy is the taller and heavier in the size.
Okay.
It's like that gheer cow. Gheer cow. Desi cow color is same. Black. Sorry, this a red and a brown color. But it is the desi cow. The breed, if we find the breed, it won't be coming from the gheer, but it will be another breed. In India, we have so many breed. I know only gheer breed. We have different breed in the Punjab, Haryana area. You might have different breed in the southern India. We may have different breed in the eastern state, Mizoram, Arunachal. So they are like that. Gheer is the area. So the breed which originates from the Gujarat, Junagadh or Gheer area, that's called the Gheer breed. But Gheer breed cow is now available, I think, in almost all the country of the world.
Okay. Have you used being in Gujarat and being practicing there? So have you used ghee cow milk or the ghee extracted from that milk?
We drink cow ghee only and milk.
Okay. But that's the majority of milk and ghee we get in Gujarat. Ghee wala.
People can stop using Jersey cow ghee or Jersey cow milk nowadays.
So we'll go to the next question. Kalpana ji asks, in most part of India, they use colostrum, that is colostrum, the initial milk from cow or buffalo, the initial milk. How good it is to consume? I believe it is guru in quality. So that's what
it is a highly medicinal value product. And for that, we need another 1 hour class. This is the only class pertaining to milk. And we have many reference of Piyusha. Piyusha is, I think, cholesterol. So you may refer in the chapter of Annapan Vidhi in all the Guhatri. But it has the highly medical this quality.
So coming to Vikramji's question, camel milk, does it nullify all forms of poisons? As you mentioned, Dr. Rajnikant, like camel milk, I suppose, is Vishahara.
Yes, it is.
So here the question is, does it nullify all poisons, or is there any specification of Visha that Sushruta Samhita has mentioned in this context?
I just read the Sushruta Sloka, but didn't went through the commentary. We might have another detailed description about what Visha exactly Acharya Sushruta is talking. But Visha is means we may use. It's not in a cobra bite we are going to give the 1 glass of camel milk.
Okay.
But where we see septicemia, the poison or toxin released by the bacteria, virus or fungus in the body, here we must take that wish, according to me.
What type of Visha we are handling also comes into the question there, so that also becomes important.
That is what I said. Any bacteria, virus or fungus infect our body, then they release a specific kind of toxins in the
toxins.
It starts the inflammatory reaction at the cellular level, and from there the samprapti starts. Okay,
so here in this context, Dr. Rajnikant, a thorough understanding of Visha properties and different classification and where which milk shall be used, that also is very important. Along with understanding the different types of milk, Dr. Rajnikant sir tells understanding the Visha and where not to administer these types of milks is also very important. So that makes sense. And we have a few more questions in the question box. Before that, a couple of people directly want to interact with Dr. Rajnikant sir. So Bhavna Sarangji has raised her hands. Bhavna ji, can you go ahead and ask your question or interact with Dr. Rajnikant?
Good evening, sir. Which ingredient we can add in milk?
The question is adding sugar or adding honey or adding ghee. So different components what we can add to make to make the milk wholesome or more potent. So what can be added?
I already explained about Udar Roga, where sometimes Charak has milk with Trikatu we have to use, milk with Shilajatu we have to use. Like that, we have many reference in majority of the disease in the Vaisya Ratnavali of Charaka, where he specifically says that milk has to be taken with this item, milk has to be taken with this item, milk with Trikatu, milk with Sunthi, milk with Shilajatu, milk with Google, milk with Rasayan Dravya. So all the references are there. Based on your condition which you want to drink, you find the reference in the Samhita and you may use.
Okay, I think that answers Bhavana's question. Yeah, thank you, Bhavana. So we'll go on to Vasanta Reddy madam. So raising her hand, Vasanta Reddy madam, you can directly converse with.
Yes, sir. Thank you, sir. Dr. Rajnikant, the question have is, I was told that the baby is weaned off from breast milk to cow milk. So, is the composition of the cow milk close to human milk? That's one question. The second one is, you said camel milk. When camel milk is prescribed, where should one go to get it? Are there any specialty shops where we can get camel milk? I mean, usually when you go to a milk shop, you have only cow milk available. Where do you get this camel milk?
So I spoke about my state in Gujarat. The big Amul dairy is there, Sumul dairy is there. They prepare 200 ml bottle in my state. I don't think in other state it is available. We advise those milk. Also, we so many patients got fresh camel milk also. We have a group of people. They keep 40 to 50 milk with them. Camel. And if nobody is getting anything, then you may order a camel milk powder, which is available online. Best quality, I think it will be there in all over the world. Online we can order. That is what I am talking. If we are not, if it is fresh thing is not available, the people should start doing the business. Business in the terms of positivity business, not like earning money and looting the people. Business to earn the money also and to help the mankind also. Like all the people in India are opening Gaushala. Like that, we must have a camel shala, we must have a oot shala, means like that. So the people gets the fresh kind of milk. That we must initiate in the community. That they should keep 10 camel milk and they can earn money by selling the fresh milk. This is how it works. It should start.
There was one more part of Vasanta Reddy Madam's question, Dr. Rajnikant, we missed out.
Yes.
So the question is, when the feeding to the infant is stopped or the child is stopped, immediately there is a transition shift from breast milk to cow's milk. The question is it because the properties are similar, or is it because the other milks are not available? That is why we are going to the cow's milk. So what's the logic there?
I think cow milk and goat milk is allowed for the infant, not just immediately after birth, but after 6 months or 1 year, when we are stopping or reducing the dependency on the mother's milk, and we start goats. In my Gujarat, when what I see or what I observed in my area, that they give goat milk also, many patients, because goat we see the reference, it is lagu to digest, it is light to digest compared to the cow milk. Reference I don't know, so I cannot comment more. But I think cow milk and goat milk are the best when we need to reduce the dependency of children on the mother's breast milk. But it doesn't mean that children should not receive mother's milk at all and start giving this animal's milk from day 10 or after 1 month itself, like that.
So along with that, I would like to add a part of the question, Dr. Rajnikant. So once there is weaning and once there is a transition or the shift of the milk feeding to the child, so if the child or the infant doesn't tolerate the cow milk, so in case we'll have, or even the goat milk, so what is the next option you would advise?
So what we do is we give little bit of Bal Chaturbhadra with them. We may use a pinch of Trikatu Churna, so it will help in deeper pacham of that thing also. So I think Bal Chaturbhadra will be the best option that is available all over the world.
So I think Bal Chaturbhadra can be searched over so the Google, and even we will get some information from Easy Ayurveda.
Just I would like to add certain information there regarding that Dr. Vasanta Reddy Madam's question. The Samhita has very clearly mentioned that the best alternative for mother's milk is goat milk or the cow milk. Here comes the point is very clearly that cow means it is their perspective is very clear. It is an Indian breed cows. It is not the Western cows which is Jersey or Holstein cows or no, not that one. It is Indian breed cows. The cows they are mentioned, and the qualities what they are mentioned is also from Indian breed cows. So that's the way they are very clearly said. When mother's milk is not available, the best alternative or the best option, which is very close to the mother's milk by its qualities, is cow milk. That's probably the one thing. The second option is that goat's milk, because of its love. And whenever you find milk is unable to digest, just like as Dr. Rajnikant said very clearly, do samskara with Trikatu or even Shunti Churna, something like that. It will definitely help to digest. There'll be no problem at all.
Thank you for the additions, Guru. Sir. Does goat milk increase vata? Vikramji's question.
No reference like that.
No reference like that. Sandyji asks the question, when can we give cow's milk to baby? At what age to introduce the cow's milk?
It will be ideal after around the 1 year of age.
Thank you. So again, Vikramji has a question. We are discussing milk of variety of animals, but isn't availability limited to regional areas where the animal can be found? So should we be like wherever what?
That is what I said. That is what I said. When we go to any community program, or we may start our own farm, because people are those who are unemployed person. You advise them this idea. You open a farm which has 10 donkey and 10 camel. You start selling milk. You go to the Ayurvedic doctor and tell them, sir, we have this available. So this is how we must start.
So again, Vikramji has one more question there regarding variation of qualities of milk depending on time at which the milk is collected. So different times milk is collected. Does it change in the properties? Is the slide specific to one type of animal, that is cows? How does it vary with other animals?
I think it is. It has to be more to do with cow only. But it is a general. We must apply our yukti. If any animal which is sleeping in the daytime also it is not active, then evening also will increase the cow. We have to use our yukti. And any animal which is totally in the movement in the night time, then that rule doesn't apply there. It will again increase the value in morning also. But we must use our yukti.
Yukti and Ayurveda wisdom, so both should be put together. So the reasoning should be there behind each question or each explanation which is there in the treatise. We need to apply the logic and apply. So while practicing or advising, that is very important there. So going to RTG's question, how long should animal milk be boiled? Boiled on high heat, medium heat, or low heat?
In slow flames, low heat, till the forms come. Till the forms form. Then like that.
So again,
There
Vikram,
is
this
no
question.
reference in Ayurveda, but to practice or to practically we may like that.
Okay, thank you there, sir. So again, Vikram, this question, what is Shodh Rog? I think it is Shota Rog, isn't it, Dr. Rajni?
Yes.
Shota, wherever there is swelling, inflammatory and non-inflammatory swelling, that we consider it as Shota or Shofa. And Kalpana ji's question, how to use Shilajit? Just make churna and mix or boil with the milk. Should it be mixed or should it be boiled with milk? Shilajit.
Shilajatu churna, some company giving churna, but actually Shilajatu should be, it is like little bit of hard paste like of thin. We may boil the milk and after that we may add it. A churna form is there, you can add like this only. You can add any day.
Thank you there, sir. So again, Sandy's question, milk diet in liver disease. Like how much quantity of milk is advised per day? How long? Plain milk or medicated milk? Jaggery or sugar can be added. Lot of sub questions there.
Quantity cannot be decided, first of all, in Ayurveda. Let it be medicine or diet. It depends on the Agni or Rogbal or Rogibal. Whatever amount patient is able to digest. Some may digest even 1 liter only. Some may need 8 liter in a day. So we cannot advise on dose. But of course, medicated milk can be given. That's what Acharya Charaka in Udaroga has explained. And plain milk also you can give. Again, time limit has no rules depending on the severity of the condition. Some patient may get 10 days a very good result. You stop in 10 days. Even I have used 6 to 8 months continuous milk, no single drop of water. So like this.
Thank you there, sir. Vikramji's question. So I think again it's an elaborate topic. Vikramji wants to know the Ayurveda perspective, if you can keep it short, the difference between A2 versus A1 milk from native ghee cows with milk from imported Jersey cows.
That is those karak, it increased the cough dose, white breed, Jersey cow. So whichever is the best in A1 or A2, the best will be the Indian breed desi cow, and the bad one in the A1 or A2 will be the Jersey cow.
Thank you there, sir. So then Sandy's question, camel milk is used in boiled or unboiled state?
No, it must be boiled and then cooled down, because what we felt is the fresh camel milk gets worms inside it within 24 hours or 48 hours if it is kept in the normal temperature. So what we advise is to put in the freezer and to make ice of the camel milk. If you want to use later part in the whole day, fresh you are taking this, boil it and warm, cool down and drink. But fresh always not possible. So today patient is taking milk, They prepare ice kind of thing in the freezer. They cut small piece, put in normal temperature, boil, calm, cool down, and drink like that.
Thank you, sir. Sir, Natural Nilimaji has a question. In some cases, if we consider milk is difficult to digest and there is also lactose intolerance, then how can we take advantage of the milk? What about those people?
We have to do with the medicated milk. We may add Shunti Churna as advised by respected Guru Raja sir. Trikatu Churna we may use, or based on the disease wise Churna we may add.
E. Ramdani ji has, Dr. Rajnikant and others, thank you for this informative class. Despite the wide array of milk and milk products available in big cities like New York, it is somewhat difficult to get milk from farms itself. There are some sources, but time constraints make it somewhat difficult to obtain. I understand the need for milk from cows which are well cared for, but I also see the difficulty. Hope things change in time. Thank you for the comment, sir. So let's see. Yeah, Natural Nilimaji, last couple of questions we'll take, Rajnikant sir. It is usually said milk is inflammatory as it is from different species. Human body cannot accept milk from other species and milk of animals is for their offsprings or calf only. Please clarify.
It is again a vast topic to say
topic,
that when we say breast milk for human is only for children, then why we are not taking the human breast milk and selling for other, and for what we see, there is a good thing and bad thing. So in our Veda, see for example non-vegetarian food. So when we say non-vegetarian or living beings, some may argue that even the grass has the life, or the vegetables and all the grass or herbs has the life. But still we are cutting them and using for our consumption. The same way animal has the life, we are cutting them and eating as our food, like non-vegetarian, vegetarian food. But our Veda, in our Veda, that is Rigveda, Yajurveda, it is permitted to use this thing as a diet. When we say non-veg, the milk is also non-veg, the wheat is also non-veg, because it is the living being. The part of living being we are eating, but we have the permission in our Shastra to eat that thing for our to maintain our life. So that's my short answer on this.
Thank you, sir. Again, vast topic, as you said, we can speak hours together on this topic. So that gives a substantial clarification for the question. Is goat milk available in powdered form? Vasanta Reddy madam question.
It is available. Many companies are prepared.
Natural Nilimaji, which time of the day is best to consume milk?
Mostly in evening, fresh milk of evening. The animal which are running in the farm and then come to the home and take up. That's what.
Sandy's question, can we add jaggery to camel's milk if there is aversion towards dairy products?
Madhur is contraindicated in Kurli road. So we cannot add any sweet item in the camel milk.
Just I wanted to add one information there, because somebody has asked how much quantity of milk should be given to a patient of liver disorder or a cirrhosis. So it definitely depends on the ascites. So if there is ascites or jalodhara, in Ayurveda very clearly said, it means you should be given totally kshira as a main diet. In my practice, I usually allow my patient to consume up to 2 liters per day, depending upon his serum albumin levels and serum protein levels. So if total protein is very less, then already there is ascitic fluid which is going as the third compartment, and definitely that is giving away the proteins from the body. So in order to replenish the loss of protein, we need to go for a protein diet, and that protein is very rich and very easily assimilated in the body is through the milk. And that's why our Acharya has very clearly said, don't give the jala kshira, because it also contains jala in it. So his requirement of water content is also completed by this process. So that is the reason, very particularly in case of ascites, that too in cirrhosis cases, definitely I have used since so many years in so many cases. So this is giving a very wonderful result, and very clearly it is a Nitya Virechana and followed by Kshirapana and hepatoprotective drugs. It is going to help in people will come back to the life very easily, even from the deathbed.
Thank you so much. Namaste and lots of love from Easy Ayurveda. Thank you.